its diagnosis, but the American people will be offering a second opinion. For now, we promised the American people that we would work to repeal this terrible law, and that is a promise we are keeping.
The gentleman from Michigan reserves his time. The gentleman from California, Mr. Waxman, is recognized.
Mr. Speaker, I yield myself 3 minutes.
The gentleman is recognized for 3 minutes.
This bill, Mr. Speaker and my colleagues, would take away the health security and cause over 30 million people to lose health coverage over the next decade. That's more people than the entire population of New York and Ohio. Yet here we go again, wasting time that should be spent on improving the economy and putting people to work. Instead, we're rehashing the same old arguments. Americans deserve health security. What's in the bill? The law that the Republicans would seek to take off the books prevents people with pre-existing conditions like pregnant women not to be denied insurance or charged so much that they can't get coverage. The law says women should not pay higher premiums just because they are women. People should have an easy, transparent marketplace to shop for quality insurance, and the hardworking middle class should receive subsidies to help them afford it. People should not be worried about losing health coverage if they lose their job. People should be encouraged to get preventive health services and not be charged for it. Small businesses should be helped if they want to offer health insurance. America should no longer be a country with millions of people uninsured and unable to get health insurance. That's what the Republicans want us to go back to. They argue that they want to repeal and replace Obamacare. Well, what's their replacement? Romneycare? They have no replacement. They offer nothing to the American people. There is no proposal on how they would keep these 30 million people insured and end insurance company abuses like pre-existing condition discrimination. Let's move beyond this vote and show the American people this institution is about more than just politics. It's about doing what's right for American families. Let's affirm our commitment to bring health security to all Americans. Let us reject this Republican bill that would again have the House go on record repealing the law which has not yet been fully put into place. Mr. Speaker, I ask unanimous consent before I yield back whatever time I have to empower our Health Subcommittee Chair, Mr. Frank Pallone from the state of New Jersey, to be able to control the rest of the time for the Energy and Commerce Committee.
Without objection, the gentleman will control the remainder of the time.
And, Mr. Speaker, I reserve the balance of our time.
The gentleman reserves. Gentleman from Michigan
I was just wondering quickly, he said the chair of the subcommittee, but I yield at this point 3 minutes to the chair of the Health Subcommittee, the gentleman from Pennsylvania, Mr. Pitts, 3 minutes.
The gentleman from Pennsylvania is recognized for 3 minutes.
Mr. Speaker, in March, to mark the 2-year anniversary of the signing of Obamacare, I invited local doctors and business owners and elected officials to talk about how the law will change the practice of health care on every level. We heard from Dr. Gerald Rothacker about the law's failure to reform medical liability reform and how young doctors don't even realize they're practicing defensive medicine, ordering unnecessary tests and driving up cost. We heard from Gary Alexander, Pennsylvania Secretary of Welfare, about how the law will cause state spending to explode in the coming years. While Medicaid consumes 30% of the state budget now, if the law is fully implemented, it will consume over 60%. Pennsylvania won't be a state government. It will be a health plan that paves roads and funds schools on the side. We also heard from Kirby Sensenig, the owner of a local roofing company. He spoke about the difficult choice he will have to make in coming years about whether to keep providing insurance for his workers or to pay the penalty and cast them into the health care exchanges. We all know how much health care reform was needed. We've all heard the stories about individuals denied care that they desperately needed. We've heard about the families who struggled to pay the bills when a child got sick. We all know someone who went without insurance because of the high cost of premiums. But this law did not fix what was broken. It didn't deliver the reform the American people really wanted. The savings, both for the government and for families, are an illusion. Don't pat yourselves on the back for gaming the CBO. There won't be a single dime saved by the law. Indeed, government spending will explode because of the law. Obamacare's new entitlement program and massive Medicaid expansion is estimated to cost taxpayers $1.8 trillion over the next decade. Things aren't much better for families under Obamacare. In 2011 alone, annual premium for an employer-sponsored family plan soared past $15,000, sharp 9% increase from 2010. 20 new taxes impose additional costs on everything from flexible spending accounts to pacemakers. 20 new taxes in Obamacare not yet implemented. Taxing medical devices, drug manufacturers, insurers, drives up the cost of care. It's a farce to think that government subsidies will balance out the increased costs imposed by all the new taxes and regulations. Finally, the reach of the federal government has extended even to the conscience of religious charities and educational institutions. When the government takes over health care, it takes over basic decisions of morality that should be left up to individuals. It's far past time we ended the destruction of our health care system by a poorly designed and administered law. Full repeal is the only way to get to real reform. I urge support for the bill, and I yield back.
The gentleman from Pennsylvania yields back his time. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 3 minutes.
The gentleman's recognized for 3 minutes.
Thank you, Mr. Speaker. Today reminds me of the movie Groundhog Day. For those of you who aren't familiar with the movie, it's about a TV weatherman who finds himself repeating the same day over and over again. No matter what he does, he's stuck on the same day. Does that sound familiar? Well, I think it does. Today we will take yet another show vote on repealing the Affordable Care Act, which will never become law. In fact, we're wasting 2 days debating its repeal when Congress should be focusing on jobs and reducing the deficit. This exercise in futility does nothing but attempt to turn the clock back on all the many benefits already in place for Americans across this country. Meanwhile, it increases the deficit, puts insurance companies back in charge of Americans' health care, increases costs and cuts benefits for Medicare seniors, and eliminates $40 billion in tax credits to help make insurance more affordable for small businesses. Mr. Speaker, the Affordable Care Act ensures that hard-working, middle-class families will get the security they deserve and protects every American from the worst insurance company abuses. The law includes numerous provisions to keep health care costs low, promote prevention, and hold insurance companies accountable. For those Americans who already have health care, whether through private insurance, Medicare, or Medicaid, the Affordable Care Act is already making your coverage more secure. For example, insurance companies no longer have unchecked power to cancel your policy, deny your child coverage due to a pre-existing condition, or charge women more than men. Over 80 million Americans have gained coverage at preventive care free of charge, like mammograms for women and wellness visits for seniors. Nearly 13 million Americans will receive a rebate this summer because their insurance company spent too much of their premium dollars on administrative costs or CEO bonuses. And 5.3 million seniors and people with disabilities have saved an average of over $600 on prescription drugs in the donut hole in Medicaid coverage, Medicare coverage. 6.6 million young adults have been able to stay on their parents' plans until the age of 26, including 3.1 million young people who are newly insured. And I hear about this all the time when I'm home in my district. And for those Americans who don't yet have health insurance, help is really on the way. Starting in 2014, the Affordable Care Act will offer an array of quality, affordable private health insurance plans to choose from. If someone can't afford insurance, or for a small business that wants to provide affordable insurance to their employees, tax credits are available that make coverage affordable. The result of this repeal, which the Republicans are putting forth today, is to basically say that millions of middle-class Americans will lose out on new health freedoms and new health coverage that make a positive difference in their lives. rather than refight these old partisan battles by starting over on health care and repealing basic protections that provide security for the middle class, Congress needs to work together to focus on the economy and create jobs. The House Republican leadership would do well to seek bipartisan solutions to jobs and the economy instead of seeking this repeal. I reserve the balance of my time.
The gentleman from New Jersey reserves the balance of his time. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 2 minutes to the Chairman Emeritus of the Energy and Commerce Committee, the gentleman from Texas, Mr. Barton. 2 minutes.
The gentleman from Texas is recognized for 2 minutes.
I thank the distinguished chairman and would ask unanimous consent to revise and extend.
Without objection, so ordered.
Thank the Speaker. Mr. Speaker, I rise in strong support of the bill before us this afternoon and in opposition to what is colloquially called Obamacare. All of the comments of the proponents of the bill that have been made in the past in support have generally turned out to either not be true at all or to be only partially true. They said that they were having the individual mandate under the Commerce Clause. The Supreme Court said that's unconstitutional, you couldn't do it, so even though you said that's what you were doing, you're really not. The proponent said that the penalties in the bill were not taxes. Well, the Supreme Court in a 5-4 majority several weeks ago said, well, really, you're not regulating the mandate and the penalties under the Commerce Clause because that would be unconstitutional. You're actually doing it under the Taxation Clause. So we're kind of in an Alice in Wonderland situation here. What is true is that if this bill does become, if this law is enforced, millions of Americans are going to pay much more for health care, and we're not going to get better quality care. People like myself oppose the bill not because we don't want every American to have health care, but because we want Americans to have choices and to make individual choices about their health care. This law, if enforced, mandates things. It mandates the coverage. It mandates what you have to have. It mandates what can be paid for it. This Independent Payment Advisory Board over time will probably mandate how doctors practice medicine. I personally think that's wrong. That's why I believe, since the Supreme Court has ruled 5-4, that we ought to have another repeal vote, even though admittedly we had one over a year ago. We should repeal it. We should put everybody on record right now where they stand, send the bill to the other body, and see if we can't get the majority leader over there to also have a vote, so as people go into the election, we know where the Congress stands on this issue. I thank the gentleman for his time.
The gentleman's time has expired. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentlewoman from California, Ms. Eshoo.
Gentlewoman from California is recognized for 1 minute and 30 seconds.
I thank the Speaker and I thank the gentleman from New Jersey. My colleagues, I think that today is really a sad day. It's a sad day for the House, and I can't help but think of Shakespeare, "Thou doth protest too much." Now, it is very clear that my Republican friends have been opposed to any kind of national health care for as long as I can remember. But today is really quite extraordinary, because the Congress not only voted, shaped on, voted on, passed, the President signed into law, it was challenged, it went to the Supreme Court, the Chief Justice and 4 other justices of the Supreme Court of our land have upheld the law for health care accessibility for every single American, all God's children. And what do the Republicans do but come to repeal? Now, my question is, what are you for? Where's your plan? I have been in the minority party. You've had time. This is the Energy and Commerce Committee. Where is your plan? You talk about markets, you talk about costs, you talk about whatever, but you have no plan for the American people. So now you've placed yourself in a position of a takeaway. And I think that's what is sad. It's sad for the American people, but it's not going to happen because the Supreme Court upheld the law.
Gentleman's time has expired. The gentleman from New Jersey reserves. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 1 minute to the gentleman from Florida, member of the Energy and Commerce Committee, Mr. Stearns. 1 minute.
The gentleman is recognized for 1 minute.
I asked to revise and extend. The gentlelady from California knows full well she serves on the Energy and Commerce Committee. All during the markup of Obamacare, we had an alternative energy plan. I'm proud to co-sponsor this bill to repeal the Affordable Care Act, Obamacare, because the act is not affordable. Cutting $500 billion from Medicare to pay for new spending is wrong. Savings in Medicare should stay in Medicare. How severe are these cuts to Medicare? The chief actuary for CMS reports that 15% of hospitals will be unprofitable within 10 years. These cuts can endanger the viability of the hospital system and jeopardize the health care available for seniors. Now, we have a whole alphabet soup of new agencies that are created by this monstrosity of law. Let me tell you, the IPAP, the Independent Payment Advisory Board, we all know what that's going to do. PCORI, Research Outcomes, CCIIO is Oversight Insurance Customers, set up all the exchanges, the PCIP, which is going to be Preventive Health Care Commission. I mean, these are all new government agencies. We need to repeal this law and start anew with common sense solutions that encourage innovation without punishing businesses, seniors, or individuals.
The gentleman's time has expired. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentleman from New York, Mr. Engel.
The gentleman from New York is recognized for 1 minute.
Thank my friend for yielding to me, and I rise in strong opposition to the legislation before us to repeal the Affordable Care Act. I won't support legislation which would allow health insurance companies to deny children access to care, which would cause Americans to lose their health care insurance, which would reopen the dreaded Medicare prescription drug donut hole, and throw young adults off their parents' insurance policies. The Republicans have proudly stated that this is the 31st repeal vote the House has taken. While the economy struggles to recover, it pains me that we have wasted so much time on these symbolic and political votes that are going nowhere. The Republicans wanted the Supreme Court to decide on health care, and now a Supreme Court has spoken, and they're still fighting it. It's time for that everyone accepts the result of the Supreme Court. This has been a long fight, and now it's over. If there are changes that need to be made to the Affordable Care Act, we should work together to make them. But partisan efforts to repeal the entirety of the law isn't what we should be doing. I don't want insurance companies getting between patients and their doctors. I don't like the current system where the insurance companies deny you coverage, or say you have a pre-existing condition, or say you have a cap and they won't pay anymore. This bill attempts to get health insurance away from the insurance companies who try to control everything and back into the hands of the consumers. So I urge my colleagues to vote against this bill, and I implore the Republican leadership to turn their focus instead on the economy and on jobs. This health care bill, there have been so many lies spread about it that it's unbelievable. The fact of the matter is, it's a good bill. It will take the 50 million Americans that don't have health care and reduce it to nothing. It is a good bill for the American people. We shouldn't be wasting our time.
The gentleman's time has expired. The gentleman from New Jersey reserves. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. I would yield at this point 1 minute to the gentleman from Kentucky, a member of the Energy and Commerce Committee, Mr. Whitfield. 1 minute.
The gentleman from Kentucky is recognized for 1 minute.
I might add that health insurance companies and pharmaceutical companies help write the President's health care bill. And 2 years ago, when the discussion was on the floor about this bill, our friends on the other side of the aisle never talked about tax increases in the bill. I assume they didn't talk about it because they didn't know about it, because the Speaker at that time said, we'll find out what's in the bill after we pass the bill. Well, when the Supreme Court upheld this law, they did so because of the taxing power of the Congress, and they said certain things were taxes. And that brought up the issue of taxes. So when we went through this bill, we found 21 new taxes on the American people that will amount to about $800 billion over 10 years. Taxes on high-cost health plans, taxes on health insurance providers, taxes on brand-name drugs, taxes on medical devices, taxes on flexible spending accounts, and others. I could go on and on and on, and I would urge the repeal of this legislation.
Gentleman's time has expired. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, again, I yield a minute and a half to the gentleman from Texas, Mr. Green.
The gentleman from Texas, Mr. Green, is recognized for a minute and a half.
Thank you, Mr. Speaker. I rise in strong opposition to the repeal of the Patient Protection and Affordable Care Act. This Congress has spent most of our time voting on messaging bills and very little actually legislating. My colleagues on the other side of the aisle and I agree on many issues. We even agree about some of the shortcomings in the Affordable Care Act. No bill is perfect, and we should be spending our time improving, not abolishing it. Repealing this bill is a vote to drop college students from their parents' health plan. It's a vote to allow insurance companies to discriminate against women and withhold life-saving procedures because of pre-existing condition. It would stop 13 million Americans from receiving rebates on their health care premiums. A repeal would mean children and families and working Americans are denied health insurance. In our district in Houston and Harris County, Texas, we have one of the highest uninsured rates in the country. The bill today denies my hardworking constituents a chance to qualify and purchase health insurance. There's no question that repeal is a bad policy. This is all politics. Mr. Speaker, I ask the majority to put partisanship aside and reach across the aisle to improve this law and not resort to partisan gimmickry that exposes our nation's most vulnerable to even more pain and suffering. And I yield back my time.
The gentleman yields back his time. The gentleman from New Jersey reserves his time. The gentleman from Michigan is recognized.
Mr. Speaker, at this point I would yield 1 minute to the gentleman from Oregon, Mr. Walden, a member of the Energy and Commerce Committee. 1 minute.
The gentleman from Oregon is recognized for 1 minute.
All right, thank you very much, Mr. Chairman. Let's face it, the law that's on the books takes $500 billion out of Medicare and spends it on a new entitlement program. I don't think taking money away from seniors' health care to create a new government-run program is right, and neither do the American people. I was a small business owner. Since 1986, we provided health insurance for the people who worked for us. As a small business owner, what I wanted was the ability to group up and have more effect in negotiating lower insurance rates for the people that we covered. This law doesn't really help in any regard to that. In fact, this is a jobs vote we're having today, because if you're a small business and you're at like 49 employees, if you go to 51, then all of a sudden the government comes in on top of you with all kinds of potential penalties and fees. And so a lot of small business owners in my district are saying, why would I grow my business? Why would I take on this new risk? I think this stymies job growth. And I can tell you out at Eastern Oregon University, I met with the university president. They used to have a student health plan that cost $66 a term. Because of this law and its implication, that student plan went up to $2,000 a year. They've had to walk away from it. This law is hurting people today. It needs to be repealed and replaced.
The gentleman's time has expired. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Thank you, Mr. Speaker. I yield a minute and a half again to the gentlewoman from Colorado, Ms. DeGette.
The gentlewoman from Colorado is recognized for a minute and a half.
Mr. Speaker, we get the message. The Republican majority wants to repeal the Affordable Care Act. We got that message the last 30 times they tried to repeal it. And after this week, the 30 million Americans who have lived in fear of bankruptcy because they didn't have health insurance before the Affordable Care Act are left to ask the same question that I've been asking for the last 30 votes. What would you replace it with? What would the Republicans tell the millions of Americans with kids with pre-existing conditions like asthma and diabetes who would lose their insurance after this vote? What would they tell the millions of seniors who have lower prescription drug prices and prevention care, which would evaporate if this bill passed? What would they tell women who, under the Affordable Care Act, won't have to pay higher insurance rates simply because they're women? What would they tell the millions of young adults who are able to stay on their parents' insurance plans who would be thrown off if this bill passed? All of those benefits and more would evaporate with this vote, and the Republican majority has nothing to say. I have an idea. Let's put this silliness aside. While these benefits continue to roll out, let's stop the political grandstanding and instead come together to make sure the law is implemented in the best possible way. That's governing, and that's what the American public sent us here to do. I yield back.
Gentlewoman from Colorado yields back her time. The gentleman from New Jersey reserves. The gentleman from Michigan is recognized.
Mr. Speaker, I would yield 1 minute to the gentleman from Nebraska, Mr. Terry, a member of the Energy and Commerce Committee. 1 minute.
The gentleman from Nebraska is recognized for 1 minute.
Mr. Speaker, the Affordable Care Act is just the opposite, unaffordable. It's chock full of new taxes, increased government spending, and provisions that are going to make health care more expensive. CBO found that this new law insurance mandates will raise premiums on individual market by an additional $2,100 per person. The Kaiser Foundation found that individual premiums have already, because of this, gone up 8% for families and 9% for individuals. And this law isn't even fully implemented yet. To add insult to injury, there's 159 new boards, offices, and panels like IPAB that give unelected bureaucrats the authority to ration health care. It raises taxes by $607 billion on middle-class families and employers at a time when we have federal deficits and prolonged unemployment, increases total federal government health spending by about $478 billion from 2014 to 21. I have voted to repeal this 30 times, and I will keep doing it until we get it right.
The gentleman's time has expired. The gentleman from Michigan reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1.5 minutes to the gentlewoman from California, Ms. Capps.
The gentlewoman from California is recognized for 1 minute.
Thank my colleague,
Minute and a
Mr.
half.
Speaker. I rise today in strong opposition to this bill that would take away insurance protections and new access to health care from tens of thousands on the central coast of California. Thanks to this law, families are telling me they no longer need to worry that their children will be denied insurance due to a pre-existing health condition. In my district alone, 9,500 students, young adults, now have health insurance through their parents' plan. A young college graduate recently came up to me at the grocery store thanking me for the peace of mind as he's looking for a job. In my communities, 59,000 seniors now receive free preventive care, and thousands of seniors in the dreaded donut hole have received discounts for prescription drugs, saving an average of $610. Now, some folks around here may not think that much of a savings of $600, but for so many, this makes a world of difference. Indeed, one of my constituents, Ella May from Napomo, wrote to me saying that thanks to this law, quote, I won't be impoverished again by the cost of my medicines. But this House majority have set up another vote, yet another one, to take away these benefits from Ella May, from my community, and from the nation. Mr. Speaker, we should be working to stimulate growth in our economy and spur job creation, not voting for a 31st time on repealing this law. I urge my colleagues to reject this bill, and I yield back.
Gentlewoman yields back her time. The gentleman from New Jersey reserves. The gentleman from Michigan is recognized.
Thank you, Mr. Speaker. I'd yield at this point 1 minute to the gentleman from Pennsylvania, member of the Energy and Commerce Committee, Dr. Murphy. 1 minute.
The gentleman from Pennsylvania is recognized for 1 minute.
Thank you, Mr. Speaker. You know, I've never doubted my friends on the other side of the aisle's compassion or sincerity, but I've always believed there was a better way of handling these health care costs to make sure that we all get the health care we need from the doctor we choose at a price we can afford. Here are some ways we need to do this. Allow people to buy across state lines. They would believe University of Minnesota studies that would drop the uninsured by 12 million. The ability to join groups, because the purchasing power of groups is what is making Medicare Part D come in at 40% under budget. Through emphasis on coordinated care, which decreases hospitalizations and avoidable readmissions and complications sometimes by 20 to 40%. By making sure health care plans are personal, portable, and permanent. If the plan you need, you take it across jobs and you can't be cut for being sick. To make sure there's tax deductions for being able to buy insurance just like employers have. To allow the chronically ill to be part of high-risk pools. To encourage people to take steps in their own life to maintain their own health. And to have better use of prescription drugs, generic and non-generic, also saves a massive amount of money because some $250 billion a year is wasted in drug problems. We need this instead of a $570 billion in new taxes and a $1.76 trillion bill. I yield back.
The gentleman yields back his time. The gentleman from Michigan reserves his time. The gentleman from New Jersey is recognized.
Mr. Speaker, can I inquire about how much time is left on both sides?
The gentleman from New Jersey has 16 3/4 minutes left. And the gentleman from Michigan has 17 minutes remaining. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentlewoman from Illinois, Ms. Schakowsky.
Gentlewoman from Illinois is recognized for a minute and a half.
I know that many Americans have heard over and over again that Obamacare is a bad thing. But now that the Supreme Court has declared it the law of the land, I hope that everyone will take another look and see what's actually in the law and how it can help you. Right now, because of Obamacare, if you're a woman, you have free preventive services like mammograms. I hope you'll take advantage of that. And no longer will being a woman be a pre-existing condition because insurance companies charge women up to 48% more for their health insurance. And because of Obamacare, right now, if you're a parent and you have a sick child with a disability, that child may not be denied health coverage. And no one has to worry about lifetime caps anymore because of Obamacare. My son, a small businessman, said, "Thanks, Mom, because of Obamacare, 35% of the cost of coverage for my employees is paid for." And when fully implemented, no one will have to worry about having a pre-existing condition. No one will be excluded. And if you're an unemployed person and you lost your job and your health care, Obamacare will make sure that you can get coverage. For the first time in the United States of America, we say that health care is a right and not just a privilege for those people who can afford it. And I yield back.
The gentlewoman yields back her time. The gentleman from New Jersey reserves. The gentleman from Michigan.
Mr. Speaker, at this point I would yield 2 minutes to the Vice Chair of the Health Subcommittee, Dr. Burgess, for 2 minutes. And when he concludes speaking, I would ask unanimous consent that the rest of my time be controlled by Mr. Pitts from Pennsylvania.
Without objection. The gentleman from Texas is recognized for 2 minutes.
And I thank the gentleman for the recognition. You know, Mr. Speaker, from the very inception, this law was bad and remains bad for America. It was written in secret down at the White House. Now our committee has exposed all of the secret deals that went on literally 3 years ago this month that led to the formation and the writing of the legislation behind closed doors. The very doors that the President, when he was running for office, said would always remain open. This would be an open and transparent process. But when it came time to actually write the law, they invited the lobbyists in, they closed the doors, and they wrote the law. We all remember the travesty of December of 2009 when the Senate passed a bill out the day before Christmas, right before a snowstorm, and this bill that was hastily drafted, full of errors, full of problems, was passed out of the Senate, and that's what was signed into law. It wasn't even a good rough draft. It never came back to the House. It never came to a conference committee. The dog ate our homework on the way to the President's office, and we just passed the rough draft and sent it on to the American people, and by golly, they'll just have to live with it. Look, there were some promises made by the President 4 years ago. One of those promises was, if you like what you have, you can keep it. Turns out what he should have been saying was, you know what, it's going to cost you a lot more to get a lot less. There were promises made to seniors that their care would not be harmed of the passage of this law, but we all know now that that's anything but true. What about our provider communities? They were promised relief from the sustainable growth rate formula. They were promised some medical liability reform. They were promised that if we expect doctors to hold down costs, we're going to at least let them get together and talk about price. But none of those things came into being, and instead, what did we get? A bill that contains 23 new taxes, albeit one has been repealed and one has been postponed under the Class Act, but still 21 taxes that remain out there for the American people. It was not necessary for it to be like this. There were Republican ideas that were stymied at the committee level, and then, of course, ultimately every House idea was stymied because the House simply took up and passed a very bad Senate bill. Kids on till 26, this was part of the Republican plan from 3 years ago. It could have been part of a bipartisan plan had the Democrats chosen to do so. They rejected that notion. I urge you to repeal this law. Let's get back to work and do it right for the American people. I'll yield back.
Gentleman's time has expired. Members are reminded to heed the gavel of the chair. The gentleman from Pennsylvania, Mr. Pitts, will control the time for the majority. He reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentleman from Texas, Mr. Gonzalez.
Gentleman from Texas is recognized for a minute and a half.
Mr. Speaker, thank you very much. Today, the Republican majority is actually telling the American people that they're better off, not getting rebates from insurance companies for not covering their health care expenses. Better off not getting preventing services under Medicare. That the American people are better off getting coverage from comprehensive women's preventive services that they never had before, that they're getting now, but you're going to be better off not getting them. This is what people have today in America because of the Affordable Care Act. The majority is telling the American people they're better off not getting protection from getting cut off when certain medical costs are incurred. They're telling the American people you're better off by not getting restrictions removed so that children get coverage despite a pre-existing condition. That you're better off not getting health coverage for children up to the age 26 on a parent's health insurance policy. And that you're better off for not getting help for Medicare recipients that fall into the donut hole. The truth is, they had over 10 years to come up with an idea, with a proposal, and nothing was ever done to help the American people gain access to affordable, quality health care through the private market, because this is what this bill is all about. 11 years, actually. And you keep saying that you have an alternative. You're going to repeal and replace, but you haven't come up with one proposal. You only know how to oppose and not propose.
The gentleman from New Jersey reserves. The gentleman from Pennsylvania is recognized.
Speaker, at this time I yield 1 minute to another member of the Energy and Commerce Committee, gentlelady from Tennessee, Ms. Blackburn.
Gentlewoman from Tennessee is recognized for 1 minute.
I thank the Speaker and I thank the Chairman for yielding, and I stand here today to support the repeal of Obamacare. Some of you are asking, how many times are we going to do this? We're going to keep at it until we get this legislation off the books. It was a bad bill. It has become a bad law. And quite frankly, if you are satisfied with a tax-based, government-controlled, limited access, bureaucrat-centric health care program, then this is for you. That is what Obamacare is. That is not what the American people want. And repeatedly they have said to us, look, Congress should admit Obamacare was a bad idea. Let's start fresh with a clean slate. Let's focus on increasing choice and options, decreasing cost and mandates, simplifying the system for both patients and providers, making certain that we restore the $500 billion of cuts that were made to Medicare and make health care tax-free. I yield back.
The gentleman from Pennsylvania reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentleman from North Carolina, Mr. Butterfield.
Gentleman from North Carolina is recognized for a minute and a half.
If you don't succeed, try and try again. Republicans are taking this phrase to a whole new level. House Republicans will vote for the second time to overturn essential provisions in the Affordable Care Act, and yes, for the 32nd time to dismantle it altogether. This repeal vote is a waste of time and tax dollars. We all know that this bill will never pass the Senate, and the President would assuredly veto it. This is purely an act of political posturing, and my colleagues on the other side of the aisle should stop their obstruction. Mr. Speaker, if the Republican majority was just as concerned with introducing a comprehensive jobs package as they've been with repealing this constitutional law that was, yes, upheld by the U.S. Supreme Court, Americans and our economy would be in a much better condition. Stop wasting our time with political theater and try passing some beneficial landmark bills of your own. My friends on the other side, you have a wrecking ball. Where is your plan? I yield back.
Gentleman from North Carolina yields back his time. The gentleman from New Jersey reserves. The gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I'm happy to yield 2 minutes to another distinguished member of the Health Subcommittee, Dr. Gingrey of Georgia.
The gentleman from Georgia is recognized for 2 minutes.
Mr. Speaker, I thank the chairman for yielding. I would like to introduce you to Sole Commissioner Boss Hogg from Harris County, Georgia. Boss Hogg used his position of authority to terrorize the citizens of his community with the help of henchmen like Sheriff Roscoe P. Coltrane in the 1970s television show The Dukes of Hazzard. Mr. Speaker, today life imitates art. We now have another boss in our midst. I call this boss Obamacare. The only health care that citizens of this country can access are those approved by the boss. If you like what you currently have, you can't keep it. Let me repeat, if you like what you currently have, you can't keep it, according to the boss. The boss and his henchmen who help fund this tyranny, they include the biggest permanent tax increase on Americans, borne in large part by middle-class families and the employers who give them jobs. It enacts a $500+ billion cut to the Medicare program, all while the program is going bankrupt. And finally, new rules that allow the boss to dictate how doctors actually practice medicine. No longer will my colleagues in the medical profession be able to put the needs of their patients first. Mr. Speaker, our forefathers rejected tyranny, and so should we. Support H.R. 6079, a bill that would repeal Obamacare. Let's get rid of the boss once and for all. And I yield back.
The gentleman from Georgia yields back his time. The gentleman from Pennsylvania reserves his time. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1.5 minutes to the gentlewoman from Florida, Ms. Castor.
Gentlewoman from Florida is recognized for 1.5 minutes.
Well, thank you, Mr. Speaker. I'd like to thank Chairman Pallone for yielding the time. He started off the debate by saying this debate reminded him of the movie Groundhog Day. I think he's right. It reminds me of a summer rerun. Republicans are forcing another political debate on the Affordable Care Act, a tired rerun when the Republicans should be joining us in focusing on creating jobs and boosting the economy. That is our #1 priority this summer. And it's a real shame. In fact, it's disheartening to hear my Republican colleagues urge repeal of vital consumer protections for American families. My Republican colleagues are undermining the economic security of middle-class families in doing so. They are urging the elimination of important improvements to Medicare, like closing the donut hole, putting cash back into the pockets of seniors who need it at this time. And what they're saying is that it's okay that people don't take personal responsibility for their health and their health care. And I think that's wrong. It is not fair that if you pay those health insurance premiums time after time and those copays, that you end up picking up the tab for those who do not. That's not fair or right, and the Affordable Care Act targets that for replacement and encourages personal responsibility. I urge my Republican colleagues not to waste our time here, but let's come together. Let's work on focus on improving the economy, creating jobs. That really is our #1 priority.
Gentlewoman's time has expired. The gentleman from New Jersey reserves his time. The gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I'm happy to yield 1 minute to the gentleman from Mississippi, Mr. Harper.
The gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. The policies and regulations resulting from the President's health care law are among the most overreaching added to the U.S. Code in modern history. Further, the President himself has said that his law's individual mandate is not a tax. Yet he's now rallying behind the Supreme Court ruling that defined this requirement as just that, a tax. Look, I have little confidence that this far-reaching law would have ever advanced had the White House and congressional Democrats united behind a tax mandate on every single American citizen. Let's be clear. The Supreme Court ruled that this law is allowable, not that it's good policy, nor that it will improve the delivery of care. This law is bad for patients and providers. It's bad for individuals and employers, and it's bad for states and jobs. This repeal will allow Americans to receive the care they need from the doctors they choose at a cost they can afford. It's that simple. Thank you, and I yield the balance of my time.
The gentleman from Mississippi yields back his time. The gentleman from Pennsylvania reserves. The gentleman from New Jersey is recognized.
And, Mr. Speaker, I would yield a minute and a half to the gentleman from New Mexico, Mr. Lujan.
The gentleman from New Mexico is recognized for a minute and a half. Without objection.
Mr. Speaker, this Republican majority's effort to repeal the Affordable Care Act is bad legislation that would undermine significant advancements to the delivery of health care services to all Americans. But let me be clear. This bill would repeal the single most important federal law that governs the delivery of health care to our first Americans, Native Americans. It's an assault on our federal responsibility to tribal communities who, without the Indian health care system, would not have meaningful access to health care services. Our Republican majority swept the rug out of Native American women and took them out of the act to protect them from domestic violence. This act that Republicans have put before us would hurt people in a very serious way. The act makes possible long-awaited improvements to the Indian health care delivery system by providing authority to provide cancer screenings, dialysis, as well as all hospice and elder care, recruit more qualified health professionals, modernize dated health facilities, and establish comprehensive behavioral health initiatives. Mr. Speaker, we need to reject this health plan. We need to reject this effort by Republicans, which is causing harm to Native Americans across America. I yield back.
The gentleman from New Mexico yields back his time. The gentleman from New Jersey reserves. The gentleman from Pennsylvania recognized.
Mr. Speaker, at this time I'm pleased to yield 1 minute to another valued member of the Health Subcommittee, Dr. Cassidy from Louisiana.
The gentleman from Louisiana is recognized for 1 minute.
Thank you, Mr. Speaker. As a practicing physician who still sees patients in a safety net hospital, I fully support the repeal of Obamacare. Let's look at Medicaid, a program which is broken and which is bankrupting states and driving federal indebtedness. Under Obamacare, it is increased spending by $100 billion, further driving indebtedness of our state and federal government. And, more importantly to me as a physician, Medicaid is associated with terrible patient outcomes. We need an alternative to these poor outcomes and this indebtedness. One reform I propose, folks have asked what ours are, is the MAC Act, the Medicaid Accountability and Care Act. The MAC Act controls spending, incentivizes quality care, helps federal funding follow the patient with other needed reforms. Chief Justice Roberts said it's not the duty of the Supreme Court to rescue the American people from bad public policy. That is up to us. Republicans seek to rescue Americans from bad public policy. We offer positive alternatives for states, for taxpayers, and most importantly for patients. I yield back.
The gentleman yields back his time. The gentleman from Pennsylvania reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentleman from Connecticut, Mr. Murphy.
The gentleman from Connecticut is recognized for a minute and a half.
Thank you very much, Mr. Speaker. You ever seen the movie Fatal Attraction? It's a great film. The Glenn Close character is so obsessed with Michael Douglas that she does everything within her power to try to win him over, flipping out at the end of the movie by going and boiling the Douglas family bunny. Well, Mr. Speaker, I would submit that having now had 30 different debates on this floor over repeal of the health care bill, that House Republicans have finally hit their boil the bunny moment. Enough is enough. The American people want us to move on. And what they would suggest is, instead of listening to their inner Glenn Close, that maybe House Republicans should start listening to people like Colleen, a 61-year-old retired teacher from Danbury. She's got diabetes. She's got sleep apnea. And what she wants is not more politics on the floor of the House of Representatives. She wants relief. She doesn't want another 5-hour debate on top of the other 29. She wants this bill implemented. I yield back.
The gentleman from Connecticut yields back his time. The gentleman from New Jersey reserves. The gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I yield 1 minute to the gentleman from Texas, Mr. Olson.
The gentleman from Texas is recognized for 1 minute.
Mr. Speaker, I rise today in support of H.R. 6079, a bill to fully repeal Obamacare. The Supreme Court rightly declared the individual mandate unconstitutional under the Commerce Clause, but unfortunately allowed it to continue as a tax. A tax. But the Supreme Court does not have the final say. The American people do at the ballot box in November, and the House has our say today. Taxpayers face tight budgets and a weak economy. With the largest tax increase in American history happening on January 1st of next year, while our president plays political games, the last thing our taxpayers need is another tax, especially one that inserts the federal government between patients and their doctors. We must repeal this intrusive law and replace it with thoughtful legislation that protects all Americans' access to quality care from the doctor they choose at a price they can afford. Mr. Speaker, I urge my colleagues today to join me in taking the next step to repeal Obamacare. Thank you. I yield back.
The gentleman from Texas yields back his time. The gentleman from Pennsylvania reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield a minute and a half to the gentleman from Georgia, Mr. Scott.
The gentleman from Georgia is recognized for a minute and a half.
Thank you very much, Mr. Pallone. Let me first of all respond to what my previous speaker on the other side has said, because it's very important that we straighten the record out. This is not a tax for people to get health care insurance. What this is, the Supreme Court ruled, and again, chaired by a Republican chairman, Supreme Court Chief of Justice. And he said that in order for the mandate to stand, Congress could only do it through their taxing authority. And that was to take care of the penalty. This is not a tax for individuals to get their health insurance. CBO says it will only affect 1% of the American people. And that is a choice that they will make. It's not a tax penalty for you to get insurance. It's a penalty for those who can afford the insurance who choose not to buy the insurance. Now, let me also make another point that is very clear. In addition to this being a program in which the vast majority of the American people approve, they do not want you to repeal their opportunity to have individuals in these tough economic times, their children, to be able to stay on their insurance till 26. They want that there. They do not want you to repeal them having to be denied insurance because of a pre-existing condition. And our hospitals need this very much in order to have the Medicaid expansion. Thank you very much.
Gentleman from New Jersey reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time I yield 1 minute to another member of the Energy and Commerce Committee, Mr. Kinzinger from Illinois.
Well, thank you, Mr. Speaker.
The gentleman from Illinois is recognized for 1 minute.
Thank you, Mr. Speaker. Yesterday, the Supreme Court made one thing very clear, or the other day, they made one thing very clear. The individual mandate is nothing more than a tax. The overall tax burden that this puts on our economy is staggering. The overall tax burden this puts on the middle class is staggering. And along with those unprecedented personal tax that this implements, let me point out two other major ones. A $20 billion device tax. Okay, you can pay for that, according to this bill. A $102 billion small business health insurance tax. This bill clearly places a huge tax burden on the American people, as said by the Supreme Court. And by the way, yesterday the administration asked for a tax increase on the majority of small businesses, but don't worry, because that's only for a year, because in a year, taxes will increase on all levels of income if the tax cuts are allowed to expire. In 2010, the American people sent a message to Washington when they sent one of the largest, boldest freshman classes that they have ever sent to Washington, D.C. We were here with the mandate. Stop the tax hike, repeal this health care law, and we'll do that. And I yield back.
Gentleman's time has expired. Gentleman from Pennsylvania reserves. The gentleman from New Jersey.
Mr. Speaker, may I inquire again about the time on both sides that remains?
The gentleman from New Jersey has 6 minutes and 3/4. And the gentleman from Pennsylvania has 8.5 minutes remaining.
I would yield now a minute and a half to the gentlewoman from California, Ms. Lee.
Gentlewoman from California is recognized for a minute and a half.
Thank you, and I want to thank the gentleman for yielding, but also for your unwavering and relentless leadership on so many important issues. I rise in strong opposition to the GOP Patients' Rights Repeal Act. Here we go again, Mr. Speaker, wasting the American people's time on voting for on this bill. I think it's for about the 31st time. This Tea Party majority is so disconnected from reality that this House takes vote after meaningless vote on bills that have no chance of ever becoming law. One of the most conservative courts in a generation has found the provisions of the health care law constitutional, and Tea Party representatives immediately took to the steps of the Supreme Court to blast the court as activists and promised a full repeal. Let's call this what it is, Mr. Speaker. It's a politically motivated waste of time because Republicans have no serious job plan. I will say, though, that the only silver lining in this incredibly sad process is that the Tea Party has finally named a bill honestly, Patients' Rights Repeal Act, because this bill does exactly that, repeal the rights of millions of patients to access to health care. Children now have a right to stay on their parents' policy until they are 26. Republicans want to repeal this right. Patients have a right to not have lifetime caps on their policies, nor have pre-existing conditions prevent them from getting health care insurance. Republicans want to now repeal this right. And yes, people will not have a right and a responsibility. May I have an additional 30 seconds? Thank you.
Additional, yield the gentlewoman another 30 seconds.
Gentlewoman's recognized.
Or a minute. Would you like a minute? A minute.
Thank you very much. And let me just say, people will not have, under this bill, a right and responsibility to see a primary care doctor rather than have taxpayers pay for their primary care in emergency rooms if this Patients' Bill of Rights or Patients' Rights Repeal Act were passed. I tell you, our seniors now, they have a right to have a reduction in their prescription drugs. This right would be repealed under this GOP Patients' Rights Bill. This is downright outrageous. Health care finally is becoming a right. People in our country deserve health care. They deserve to have the benefits that our society has provided for so many years in helping achieve the American dream. Finally, they will not have to go bankrupt due to high health care costs. Finally, yes, they will have a right to health care, which of course now the Tea Party is calling for the repeal, as it is called the GOP Patients' Rights Repeal Act.
Gentlewoman's time has expired. The gentleman from New Jersey reserves. The gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I'm pleased to yield 1 minute to the gentleman from Montana, Mr. Rayburn.
The gentleman from Montana is recognized for 1 minute.
Yesterday, President Obama promised to increase taxes on our small businesses. At a time when we need to support job creation, raising taxes is the last thing we need to be doing. It makes the problem worse. A couple of weeks ago, the Supreme Court confirmed that the President's health care law imposes the single largest permanent tax increase in history. Worse, nearly half of this regressive tax will hit the struggling middle class. Add more than 13,000 pages of new health care regulations so far, and it's easy to see why President Obama's economy doesn't create jobs. It's too busy creating government. We need a new direction, but at every step the Senate stands in the way. The solution? Repeal this harmful law so we can get to work putting America back to work. I yield back my time.
Gentleman from New Jersey.
Mr. Speaker, I have no additional speakers at this time. I'll reserve and let my colleague from Pennsylvania.
Gentleman from New Jersey reserves his time. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 1 minute to the distinguished member from Wisconsin, Mr. Sensenbrenner.
Gentleman from Wisconsin is recognized.
Thank you,
for 1 minute?
Mr. Speaker. We've heard an awful lot about taxes and the Supreme Court decision. I would like to talk about a tax that was labeled a tax in the Affordable Care Act when it was passed in 2010. The Act amended Internal Revenue Code Section 4980D, and it imposed a tax of $100 per employee per day on any employer that did not follow any mandate of the Secretary of Health and Human Services. There was no conscience exemption. There was no religious employer exemption. And $100 per employee per day is $36,500 per year. That means that a parochial school with 50 employees has to pay a tax of $1,825,000 each year. The only way to repeal this tax today is to pass this bill. And if this bill is defeated and does not become law, we have put all religious employers out of business. I yield back the balance of my time.
Gentleman's time has expired. Gentleman from New Jersey, continue to reserve.
Yes, Mr.
Gentleman
Speaker.
reserves. Gentleman from Pennsylvania.
Mr. Speaker, I'm pleased at this time to yield 1 minute to the distinguished member from Nebraska, Mr. Fortenberry.
Gentleman from Nebraska is recognized for 1 minute.
Thank you, gentleman from Pennsylvania. Mr. Speaker, this weekend back home in Lincoln, Nebraska, at a small business, the shop's owner named Mary and another woman were engaged in conversation, and she looked up when they were done and saw me, and she said, "Oh, I could ask you this question. Who is going to pay for this health care bill?" And I basically responded, yes, that's the right question, because right now we are seeing some benefits from some reasonable reforms, such as being able to keep children on health care policies of their parents until they're 26, such as allowing people who have significant pre-existing conditions some hope for affordable insurance. But there are other hard realities that must be faced here. This bill shifts costs to more unsustainable government spending. It cuts Medicare and it erodes health care liberties. The total cost is now projected to be $1.7 trillion. It has 21 new taxes in it, and many small businesses are going to actually drop coverage or cut jobs as this moves forward. Mr. Speaker, there is a better way to move forward. We need the right type of reform that will actually improve outcomes while reducing costs and protecting vulnerable persons. I yield back.
Gentleman from New Jersey, does he continue to reserve?
Yes, Mr. Speaker.
Gentleman reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this